you don't see Shelley. Shelley's,
Unless that's her, but I don't see her
no,
on
this
here yet.
says meeting is now streaming live on YouTube. Is that live now?
That's, yes,
Okay, even though before we started the meeting?
yes.
Okay. We should probably do that after we start the meeting, but that's okay. Is that how you've always done it?
Yes,
Oh,
yeah,
okay,
just because it's 6:30 now.
right. Well, I can't call the meeting to order until I have a quorum.
Right.
So 1, 2, 3, 4, waiting for one more person.
Media Space is not a board member?
Yes, it is. It's Mike. Mike
Oh,
Kusa.
it is you, Mike. Thank goodness. We were hoping it was you.
We're golden.
Okay. So let me just get out of this and I will call the meeting to order at 6:31, the regular Board of Education meeting, Tuesday, February 22nd, 2022. So roll call. Oh, no, I'm sorry. Pledge of Allegiance is first. So I pledge allegiance to the
allegiance
flag
to
of
the
the
flag
United States of
United
America
States of
and
America.
to the republic for
Republic
which it
for which it
stands,
stands,
one nation,
nation,
under God,
under God,
indivisible,
indivisible,
with liberty
liberty
and justice for all.
all.
Thank you. So roll call, I will call the people who are here and you can just second that. So I see Deb Sherman,
Here.
Mike Kuza,
Here.
Joe Manisovich,
Present.
and Vic Tomporowski, Stephanie
Here.
Miller,
And Steve just joined.
and Steve just joined.
Here.
Okay, and then obviously in attendance is Mr. Anthony Hibbert and Dr. Robert Miller. Are there amendments to the agenda?
No.
Hearing none, we can go on to our minutes, and I'd like to have a special thank you to our jack of all trades, Debbie Sherman, who has now, been charged with doing our minutes or cleaning them up for the time being. So thank you, Deb.
No problem.
You're the best.
Anything for you guys.
Yeah.
Thanks, Deb.
Thank you.
So go ahead, Deb, with the motion.
Motion to approve the January 20th Board of Education special meeting minute.
Second.
Second from Mike. Are there any changes or discussion? Seeing none, all those in favor?
Aye.
Aye.
Oppose? Abstain? Motion carries.
Motion to approve the January 25th Board of Education meeting minutes.
Second.
Second from Mike. Any changes or comments? All those in favor?
Aye.
Oppose? Abstain? Motion carries. If there is anyone in the audience of citizens that would like to address the board, because this is a Zoom meeting, you can just either put your hand up or you can indicate that you would like to speak.
No one else
And
here.
Robert, no one else is here. Okay. Deb, is there any board correspondence?
There is not.
Okay. So budget discussion and possible approval. So now we've been working the budget. The finance subcommittee has met. We've given the whole board as much information as we have. Mike, is there anything else that you'd like to add? We've gotten our budget down to a 2.97% increase, which the finance committee is comfortable with. So did you want to add anything to that, Mike?
Not at this time. I think everything has been collected, presented, and gone over. I
Dissected.
think that, yeah. I mean, at this point, I'm ready to present it to the board in its final draft at this point.
Great.
And the budget book that we gave and the revised document that highlighted how we took from the first proposed budget to the 2.97 is the same exact document that was presented at the last Board of Education meeting. So nothing changed from last meeting through tonight.
Okay, great. Is there any further discussion, or does anybody have any questions or comments about the budget before we make a motion? Okay, seeing none. Deb, do you have a motion for that?
Motion to approve the budget proposal for $33,103,090 for a 2.97% increase.
Second.
Second from Joe. Any further discussion? Hearing none. All those in favor,
Aye.
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 oppose, or abstain? Budget passes.
Thank you, everybody.
All right.
Thanks for all the
I
hard
do
work.
have, yeah, I do just have a quick question. Do we have a date that we have to present it yet to the Board of Finance?
Yes, we do. We are scheduled for, hold on, March 3rd at 6 p.m.
Okay, and that's at Town Hall?
Town Hall. So Mike, I'd like to have
Any
a conversation with
limitations?
you the next couple of days to discuss how we want to present that.
What's the time again?
6
6 o'clock.
p.m.
6 p.m. Okay.
And then we have, and under our action items, we have a kindergarten registration request. So Robert, if you can just kind of fill the board in on that, please.
Absolutely. So by state statute, kindergarten students need to be born prior to December 31st in order to register for kindergarten for the following school year. We were approached by a father that believes that his child should register, could register for next year. The child's birth date is late January. I'm not going to identify whether it's a boy or girl or the birth date, just to keep confidentiality there. The principals had a conversation with the parent to inform him that in her entire extent of teaching and administration in Quaker, there's only been one request that has reached the board level, and the board decided not to take any action on allowing that student to register early. I had a conversation with the father twice now, tried to dissuade him from registering for a number of different reasons, but he still feels that it's his right to ask the board to consider taking action whether or not he could register for the following September. So that's why I'm bringing it to you tonight. Once again, the state statute is December 31st. The child's birth date is late January.
And that you
The
have to
board
be
just-
5. That's just, I
That's
mean,
correct.
I'm sure that's obvious,
Yes.
but you have to be 5 by December 31st.
Yes, I should have said that. Thank you.
No, that's okay.
Yeah.
So even those kids who are born in December are really starting kindergarten at age 4, and they're not turning 5 until December. Right,
Correct.
but that's within the parameters, and it's the parents'
Decision.
prerogative to send them in.
Right.
So does anybody have a comment or thought about this on the board?
I just had a question, like, maybe it's not relevant or germane, but what was the rationale?
He believes that his child is academically and socially advanced and would do well in attending kindergarten next fall.
Child truly shows some sort of advancement at this age, and it's not a parent's wish to, I mean, you never know, but really just to drive it because their belief system, period.
That's correct. That's correct.
I'm sorry, what was
That's-
your last part of your sentence, Steve? I didn't hear it.
Well, I was surely trying to parse out, not that we would know the truth, but is this really a parent who sees a child who, I don't want to use the extreme of a savant or something, but is so advanced that they clearly could benefit from this, right? Or it's just one of those parents that my kid's going to go to school really early because I think it's the right thing to do, period.
Right.
I mean, according to the father, he believes his child is academically advanced. I can't vouch for the credibility to that statement or not. That's what he's told me.
Right.
My challenge is if we decide to allow this child to enroll in the fall, it's a slippery slope. Now we're going to begin to having any parent that says my child's
Yeah.
birth date is January. Where does
Mhm.
that line cross? Where do you stop?
Well, that's a precedent, right? But I don't know how many people would take us up on it, but yeah, I get it.
So
Go
I just
ahead.
have a quick question. Does this
Sure.
child attend preschool, or would we have any feedback on that?
The child does attend preschool right now.
So the child could. see
In our
that.
pre-K?
Not our
as a
pre-K.
peer model?
No,
Oh.
not in our school.
Well, a couple of things. Number one, it's very precarious to test. I mean, there are evaluations that could test giftedness in children if you're talking about pure giftedness in children that young, however, they're not necessarily that reliable. And quite frankly, if the child is that advanced, then they're going to always need some kind of supplementation, because they're going to be beyond the kindergarten, they're going to be beyond first grade, they're going to be beyond second grade, so that's number one. Number two, I agree with Robert that, so whenever this child's birthday is, the child that's born the day before, then we'd have to let them in. The day before that, we'd have to let them in, because, we're just opening up that, that Pandora's box. Or somebody saying, well, my kid's born the beginning of February. I agree that I think it's a slippery slope to start with that. So
Can I ask,
anybody else have a comment?
yeah, what, do we have a policy on this specifically?
We
Says-
do not
State.
have it's state statutes. The state allows local boards of education to make a decision if the parent requests beyond December 31st.
Yeah, I
But the
agree.
state statute says December 31st, right?
Yes.
Correct.
I think
I'd agree as well.
I think it sets a precedent.
So it sounds like I'm hearing that the board is not going to grant this request. Is that
Okay.
inaccurate, or does anybody have anything else to?
Can I ask one other question? Does the
Sure.
parent want to enroll this child in our pre-K program? Is he, is it a,
Peer model?
yes,
And it's a conversation I can have with the parent. We did not discuss that element. Shelley's trying to get in now.
Mhm.
So Shelley's now in attendance.
Okay, good. So that's at 6:42. Deb, if you want to. put
Got
that-
it.
Hi, Shell.
I apologize couldn't get in, so
No
I
problem.
want to add me and I'm going back on mute till needed. Thank you.
Okay, just to let you know, we just had a discussion on a request for a kindergartner who is born after December 31st, would be 5 in January. Request to start early, and the board members that are here, so far the consensus is that we're not in favor of changing that statute.
Okay, too late to vote, but I.
No, we haven't voted yet. We're not
Oh.
really voting. I mean, we're not right now. I mean, we're not voting because there's nothing right now to vote on. We're just having the discussion. And at this point, the board is not granting this request.
Understood. Okay, thank you. I certainly agree.
Okay, great. So anything else on this subject, Robert, that we need to do?
Nope, that's all. I will let the father know that the board discussed it and the decision is not to move forward with it.
Okay.
I do like the idea of trying to get maybe the child as a peer model in our pre-K. So maybe we could reach out again on that. That's a good idea.
I
Good
will
idea.
definitely suggest that.
And report of the superintendent, Robert.
Okay, just a few items. One, I attended a state call this morning with the Department of Education, Department of Public Health, and they provided more guidance on the changes effective the 28th or March 1st, if you will, relating to masks and quarantine. And the one piece of advice that they had is actually two. It's all a matter of risk tolerance. What are we comfortable with as a district in terms of the rules and parameters we're going to establish? The one thing that they kind of heads back to was quarantining. And that being, if you're sick with COVID, they recommend to stay home for 5 days before returning to school. They would like schools to continue heeding that guidance, but everything else is really up for discussion at the local level. That's the one piece that they're recommending. They kept insisting, and this is just sound logic, if you're sick or you've got symptoms, stay home. And it's the same advice you've always had even before COVID. If you think that you're ill, don't go to school, stay home until you're fever free for 24 hours. And that's really the primary takeaway I took from this morning's call. The second piece of information I had to convey to parents tomorrow or Thursday is that buses fall under federal guidelines and not state guidelines, which means any student or adult on a bus needs to continue wearing a mask. That's going to continue at least until mid-March, possibly April. And that's not done at the state level, that's federal.
And there's
Tomorrow,
no, I was gonna say,
there's nothing that-
that's changed.
nothing that we can do about it. I'm just going to let parents know that children need to wear masks in the bus. We'll have disposable masks available in buses. We're not going to have bus drivers pull the buses over and call parents. We're just telling parents children need to wear masks in buses. We might see an uptick on parents dropping kids off for a period of time. But this is not something that's a local or state decision from what we've learned.
Okay.
Tomorrow, and yeah, you had a question,
Just a
Joe?
quick question back to point one. So not
Yes.
the bus point, the other point. So at this point, the state has made some recommendations. It's risk tolerance. At this point, we are not as a board following any specific recommendations. Correct?
And no, we need to have some internal discussions with our administrators and nurses. For example, one of the advices that a lot of school districts are doing is if you go to the nurse's office, then you need to put a mask on, which kind of makes sense when if you go into a doctor's office, you're ill, you're protecting the people around you. But other than that, once we suspend the policy this evening, it becomes personal choice. We are encouraging our staff to have conversations with children this week, and they started last week, about respecting the classroom and respecting each other's choices at the personal level. I don't see us putting any restrictions on music or other activities. The only thing that we're hedging our bet on is participants at events, large scale events. For example, there's a large scale event this weekend at the high school. We're limiting to 450, 500 people. We're not unlimited attendees, but other than that, it's pretty wide open.
Yeah.
I have a
And I
question.
agree, getting ahead of the potential bullying component of it.
Yep.
I'm completely on board with that. And there was one more question I had. Is there still a policy of when you're quarantining, if you're vaccinated, unvaccinated, it's 5 or 10 days? Is there still guidelines there still, or does that go on?
The guidelines kind of changed for everybody on December 31st. And that was if you're sick, stay home for the 5 days and return on day 6, and then wear masks day 6 through 10. We basically will tell staff and students return on day 6, and we're not going to require you to wear a mask. There are some districts that might, and we have to watch the numbers. If the numbers take the other direction and go through the roof, then we need to reconsider some of our local decisions, but we are not going to be requiring people to wear masks.
Okay, and so there is no discrepancy between that anymore, okay? Between
No, and
masks.
we stopped
Okay.
contact tracing in schools. If
Okay.
you happen to believe that you are in contact with somebody that's COVID positive outside of school, and there's a high risk that you could have it, then stay home and quarantine. But that's not a requirement within the schools. We stopped contact tracing 2 months ago.
Okay, I didn't pick up on, because I thought we had still done some. And I was wondering when that was going to get lifted and you kind of got freed up. But
Yeah, it really became a family choice and letting the nurses know if they had contact outside of school. Our nurses have been
okay,
pretty much outside of the contact tracing business for a while now.
I probably got stuck on your note saying this many kids are in quarantine still, that's probably where I kind of thought. Sorry.
Yeah, and all those numbers are self-reported from families.
Okay, got it. Sorry for confusion.
That's
No
okay.
problem. I have a question. So when you do have the conversations with the nurses, so if a child goes to the nurse and let's say has cold symptoms or a fever, then we won't say you have to present a negative COVID test in order to come back. It's just like you could have the child has a fever, just like any other time a child is sick with a fever, they're sent home and they're asked to not return until the fever is gone 24 hours.
Right.
Exactly.
The only difference is now you have COVID tests to send home with the child to see if they want to take it at home, which means they
But
take the
it's
test.
not something that we are requiring.
It is not.
Okay.
Yeah.
Can I just, when we let parents know about the bullying with the masking, and I'm really concerned about kid to kid bullying, but I'm also worrying staff to staff. So can we just maybe cite something out of the bullying policy or state where they can look at the bullying policy, because I'm really concerned because there are people in, you know, kids that, and parents that might not necessarily understand how it might affect other people. I mean,
Yep.
so I just want to make sure that we let people know that we're not going to tolerate people bullying either way. So,
Right.
Right.
Either direction. And I had a good conversation, very good conversation with the student government at the high school last week. And we spoke about what to do and how they need to be leaders and model for other students in the school, not to be bystanders. If you see something that's inappropriate, you've got to say something.
Mhm.
And that's the
I
type
agree.
of conversations that the teachers were expected to have across the district. There'll be a reminder for them to do so again the next 2 days as well.
thank you.
Yeah,
Yeah.
Devin, I think you're right about the staff too, because I mean, I had a staff member sort of indirectly come to me and mention they were bullied for not being vaccinated.
Yeah,
So,
it works.
it has occurred.
Works both ways.
Exactly.
Yes, it does. It does. It's a matter of respect and personal choice.
Absolutely.
Yeah.
You know, we're doing what we're doing, but they need to also have respect for each other and have enough respect for themselves, not to bring themselves to get to that point. So,
Right.
Completely agree.
Joe?
Just real quick, I know we might anticipate an uptick because I really think if when we point out the fact that the kids have to still wear the masks on the bus due to the federal guidelines, is there any way with that announcement, we might be able to reach out to the Oxford Police Department to assist with traffic on 188 and or Great Oak Road and so forth, getting cars in and off Governors and or Hogsback with the morning traffic? That's, you know, I could just see that possibly upticking traffic.
Yeah,
in the morning.
we could have the conversation with them, make engage to see how the first few days go.
Yep. Okay.
our ASOs and SROs can also assist with that
I
as
was
well.
just gonna ask if they do that.
They typically do. Jose
Okay.
is not outside of the high school. He's typically inside when students arrive, but the other ASOs and typically are out and about helping on traffic duty.
You definitely, I mean, the problem is, like, I'll give you an example, the entrance at Oxford High School, it
Mhm.
gets really chaotic now, you know, this might add to it. So I'm just concerned about that. That's all.
Yeah, we certainly can. It makes sense to monitor for the first few days and see what happens.
As long as we don't get a $250 an hour bill.
That
If they're on
happens.
shift and they're not on the call, they should be directing traffic. So
Yeah,
Yeah.
well,
I appreciate them for
Yeah.
that. So.
Any other questions with buses or with quarantining or guidelines?
I do have a question. So, I mean, Deb hit on the bullying and several other people have. I wondered, this is the first question, would it make sense to, push out some of our anti-bullying instruction or campaign or something? Because I'm concerned also that we might need to do more than send out communication, talk to administrators and all that. Some kids that are being bullied may not come forward with a complaint. So that's question one. Question two is probably a moot point because I think that people that have their opinions and they are, pretty locked into them. But I just read a study yesterday of a medical study that they have found that the N95s, KN95s, not sure about surgical mask, I will go back and check, but that not only do they protect other people, but they have now found, that they protect the one wearing the mask from micro droplets and so forth. I don't know if it might help at all in the bullying campaign. I don't know if it would be even persuasive to anybody, but that was I felt a pretty important study, but I just don't know whether any of you think it would be helpful. Thank you.
I don't really know what the question is, Shelley, sorry. So I think what you're saying is that maybe we can, just ask the teachers to, like Deb said, either, review the policy. And, the other thing is the word bullying is just so, and I hate to use another word but so triggering. I mean, it's just be kind, I mean, there's no reason why you need to, because then, everyone wants to know the definition of bullying, and the bullying is more than one act in the same student to gain power. It's just be kind. And if you don't have
Maybe that's
anything
a better
nice to
way.
say, don't say anything at all. And people have the right to wear a mask or not wear a mask or wear a hazmat suit if they want. It's their own protection, and you don't have any right to comment on it. So
Right, the teachers are
Absolutely.
gonna, the teachers are gonna have conversations and already started kindergarten on up about your child, the student next to you might not be wearing a mask, and they might be wearing a mask, and that's okay for that to be different than what you're doing. What
Yeah.
you need to do is understand what your parents and your family have asked you to do, especially the lower levels. And kindergarten and first, second will remind students over the course of the day that they need to heed that. But high school students and middle school students are going to make some personal choices in this, but it's all a matter of respect and continually reminding students that it's okay to do something different than your neighbor is doing.
I
And
tell you
just
what,
respect that.
right. And I'll tell you what I'm even more, not afraid of, but interested in, especially the K1 and 2, who basically this has been their experience in school. I have a feeling that the teachers are going to have to spend a lot of time reacclimating them to socializing. I mean, so it's going to be okay. The kids were kind of taught, and I even see them just in general. They seem, they of distancing and being, leery of being too close to people. So, I mean, I think that, from a psychological standpoint, needs to be really focused on for the little ones, because, they've grown up in the last couple of years saying, stay away from your friends. And now, they're going to almost have to learn that they don't know what they're going back to, that you used to be able to play and hug and hang out with your friends and shake hands and, the whole thing. So that's going to be interesting to me.
Well, I
Gonna-
like the way that you changed the word, Stephanie, bullying to be kind and all that. I haven't looked at our bullying curriculum in ages, but maybe if we push it out sort of in using your words, and, I heard Rob say they talk to the, teachers and so forth. So maybe there's some kind of a message using Rob's pushing out to, administrators and so forth, and using Stephanie's words, not the exact ones, but they, Stephanie, that whole sort of bulleted list that you had regarding, how to phrase it and all of that.
Right. Well, I'm sure
Rob,
Deb got that word for word, because that was just,
Yeah,
random
right.
on my part. So,
Yes.
okay.
and you know what, quite frankly, I have to tell you that I trust the adults in these schools, in our schools, and they're going to know. I don't think we need to tell them to do, bullying lessons, or I think they're going to take care of it the way, you would do under any normal circumstance, and how you would
And-
handle it within your class, and
I
how you
just know
handle it
that-
at your age level, because, especially in middle
It's-
school.
Yep. I'm just concerned about the kids that won't report it, but it sounds like you're saying, you and Rob and Deb earlier, that you think the teachers will really be on top of it, and
Yes.
maybe they'll get a handle on it. So I think that answers that question completely. And the other
Yes.
one was just a throw out, probably won't make any difference anywhere, but I thought it was great new information to have if anyone was interested.
Okay.
And to that degree, Shelley, we have a supply of N95 masks from the state that's available. Any staff or upper teen that wants to have those are available. And we've got a pretty heavy supply, and there's supposed to be more if we run out of that supply.
Okay, great. Thank you, everybody, for that discussion. And Rob, if you ever need that article, or Stephanie or anyone, I'll dig up my link to it and send it along if it
Okay.
becomes relevant. And that's it.
Thank you.
Thank
I'm moving off COVID
Yeah.
for the moment. At the high school, there'll be conferences tomorrow and Thursday, so the early release days for the high school students on both of those days. Anthony is currently working on the beginning of the food services bid. It's done every several years. Our contract actually expired last year, but we had brought it to the board to delay the bid to this current school year. So Anthony is currently working on that. I put in the last update to you that the bid came in for the water for the high school field. So we need to schedule our next meeting for a facilities committee to talk about that bid package that came in for those different options that we have. I mentioned the date for the budget we presented to the finance committee, board of finance. I also want to schedule some public presentations to our parents, the community about the budget. So I'll get that started for March. And that's my updates to you.
Okay. Any more
Thanks, Rob.
questions for Robert from anyone? Okay. I do not have a report, so we can move on to our subcommittee reports. Joe, anything in facilities?
No, I think Dr. Miller covered it. I think the water line is going to be the subject of the facility, so go for that.
Okay.
Sorry to steal your thunder.
No, you're good.
Is there a facilities meeting set up in the books, or you just?
No, I'll hook up with Dr. Miller tomorrow or the following day, or even Mr. Hibbert, so we'll get one scheduled.
Okay.
Sounds good.
Deb, curriculum?
Our next meeting is March 7th at 4:30. I posted up some agenda items and Rob and I will go through them. There's a couple that we don't need to do at this meeting. We'll send them out a little bit. Try not to have a 2-hour meeting, so.
Thank you.
Thank you. Nicole is not here, so Deb is her substitute. So Deb, the master of all trades. No, you have to, no, in all honesty, do you want me to do this part so that you can take
No.
notes?
Because
Okay.
I have it written down already.
Okay,
So the motion would be to suspend the face mask and covering policy effective 2/27 at 12 a.m.
Second.
any discussion or comments, questions? All right, so that the only thing that's different in this is that when we talked at the last meeting, we said it was as of March 1st, but now Robert said that it's midnight, the 27th, so that makes it kind of a clean break. So starting Monday, the 28th, that's when the masks will be optional. So that's the only kind of difference. And then, suspending the policies means, I mean, we can do that at any time, so you don't need a second reading or whatever. So any further discussion or questions? Okay, all those in favor?
Aye.
Oppose? Abstain? Motion carries.
And I have one more. Motion to suspend the COVID-19 staff vaccination policy effective February.
Breaking up, Deb.
Oh, sorry.
Yeah, just get
Better?
closer to your mic. Yeah, that's better.
Motion to suspend the COVID-19 staff vaccination policy effective February 27th at 12 a.m.
Second.
Any further discussion?
That Mike?
Yes.
Can I just say one thing? I know that over the past couple of years, it's been really trying on a lot of people, and I respect everybody's views on stuff. It's just, I think that as things have evolved, I truly believe, and I want to thank everybody's patience in getting to this point of this vote. So I appreciate it. Everybody on this board has done a great job. Staff, administration, even the students and the parents. Thank you very much for letting us have the abilities to make the sensible decisions on this. So thank you.
I have one quick question, and Deb, I'm sure you guys are handling it, but based on what Rob's call said about, if there's any change in numbers, or if the DPH tells us, we need to adjust anything, do we need any kind of language in there to that effect? Or, just subject to, DPH or any of those changeability items?
We'd have to come back and have a discussion about it, but there's no other language that needs to be in there.
Okay, thank you.
Yeah.
Right. And Shelley, we've had a lot of conversations about this with our superintendent's group. Essentially, it'd be no different than if there's a major outbreak of flu. So if we had that as an example, our local health district would come down to us and say, you know what, we see a 70% transmission rate of flu. We recommend that the school either implement these safety procedures or shut down for 3 days or do X, Y, and Z. If they were to come to and say, we see the positive rate of COVID now spiking through the roof, these are the precautions that we're telling you what you need to do, then we would probably heed that advice and follow them for that short period of time and exactly what we need to do for that. And that does not require a board policy to follow local guidance in that regard. And that's
But
no
would it-
different than if there's,
But would it require the board to have a discussion on it, or is it just at the superintendent level?
it'd be at the superintendent level at that point. Because at that point, it would probably be a very short period of time. If there was, we need to mask on for another 3 months, it would come back to the board. But if it's a matter of, we need to implement these guidelines for 3 or 4 days or for a week, that would not need to come back to the board.
I think we should at least know about it. I think that becomes a slippery slope, nothing geared towards you, Rob, at all, but our health departments and our DPH, quite honestly, have other agendas and have been,
Mhm.
the legislature has given them certain powers that are written in the code that just passed. So I think it should be very transparent to us. And personally, I would be, in some cases, wanting the data and backup from that DPH.
Yeah,
Well,
I agree,
Right.
because I also believe that DPH is our guidelines as opposed to our hands were tied by executive order. So I think that makes a huge difference in what you are mandated to do and what you are guided to do. So
Right.
I agree.
I think we've all worked really well together through this whole crisis and whatever else has been going on. So I'm sure that Rob would have a discussion, and if we needed to, we could call a really quick board meeting
Correct.
and talk about it.
Yeah.
We've all worked really well through it, so I don't think
I
that
agree.
be a
I agree.
problem.
And that's why I made the recommendation to suspend the policy, because if things went sideways and you need to have a discussion and change the policy, then it gives you the opportunity to do it at that point.
Okay.
Those are all great pieces of information. I think you covered it. And as usual, you guys are all on top of it. So thank you.
So, I mean, I also want to add, there's a few things here. I mean, one is right now, there's state statutes that cover things, and with them extending the governor's emergency power, those states, the state legislature has turned that power over to Governor Lamont. As long as that executive order and they keep kicking it down the road, state statute does not cover it, just like if it was a measles outbreak in the community. So, he still kind of has his finger on the scale and on the button to stop this. And no matter what at this point, I would look at it as no matter what we think or anything, until those executive orders and his executive powers are rescinded by the state legislature, there's no way that those laws that give the Department of Public Health matter at that point. They still have ultimate say, but it's not going to matter what our policy is. But I mean, we can have a discussion about it, but
Right.
let's be clear on the avenue in the lane that we have that they're in, and how much influence they could have over us. So.
That's a good point, Joe. And I do recall reading it in the whole legislature discussion and all of that there is that possibility built in also. So thanks for that point too. Thanks to everyone.
Were you going to say something, Robert?
No, just that the executive orders related to the face mask, basically what the legislation state was that the department down to the local level has the discretion of implementing their own policies through June 28th. That was the date that they set in the legislation.
Okay.
Yeah.
Well, hopefully we continue on the trend that we're on. Any further
Yes.
discussion, questions, comments? Okay. Mike, I think,
vote?
vote on, that was still a discussion? I'm sorry. I forgot we had a motion on the table.
I'm sure.
Um,
I'm
So
sure
yes,
do, we
the
do.
motion was to suspend the vaccination policy,
COVID-19.
COVID-19 vaccination policy. So all those in favor,
Aye.
Aye.
oppose, abstain, motion carries.
Thank you.
Okay, thanks for keeping me on target, Deb.
I'm just doing the minutes, that's all.
You're the best. So Mike, I think that, you've been front and center for so long. I don't know if there's anything else you need to add for finance. Is he
No, it's
still
just,
on? Oh, good.
I'm still on.
Good.
It's just Dr. Miller and I will come up with a date for our next subcommittee meeting. And, we've got the presentation to the finance, board, and we'll just go from there. So at this
Okay.
point, I don't think there's anything new.
Right.
I
Thanks
just
for
like to make sure
everything.
we let parents know that when the meeting is.
Yes.
So they can actually, because, they seem like they were wanting to follow it, whether they'll still follow it past this point or not. But I just think it's really important that we let them know about the March 3rd appointment, so.
Yeah.
Yes.
Do we know if there's a limitation at town hall for the meeting? And is there going to be like a Zoom component?
I will find that out.
Great.
The Board of Finance with Zoom is terrible, so if we can, ask if we can bring our owl with us.
You
If
can
we can.
check.
Because,
Yeah.
I mean, literally, when they have their meetings, they're using their,
One
Jim
computer.
Oliva's laptop.
Yeah.
And it's ridiculous, so.
You can't hear
maybe-
anyone or see
Right.
anyone.
Nope. So especially if we're gonna invite parents, we should try and see if we can get the
Yeah.
audio to be
Yeah,
decent.
good point.
Okay. So we are now to liaison reports, and I don't have anything for Oasis. Robert, when is that? Is it the meeting with the parents?
The freshman panel is actually the same night as the Board of Finance meeting, that the 3rd. It's in the
Oh,
evening.
dear.
Yes.
Okay, and did I read in the weekly newsletters that this is mandated?
What they're doing is they make it required for all freshman students, their parents to watch. It is a virtual event this year. The panelists are going to be live at Vinnie's Church, apparently, it's in Ansonia, Derby. And then there are a couple younger people that will be videoed and broadcast as a recorded session. These kids that have been in trouble with substance abuse, they just didn't want to do that part live. And then any student that does not watch it live will be required to in school watch it. All students will be held accountable by doing a Google form and some form of literary component, most likely tied to language arts. So there will be an accountability to make sure that all students watch either live that night or in school
Okay.
after the event.
Okay, great, thank you. Anybody else? PTO?
PTO meeting was last week. They had a very successful Hershey candy bar sale. They have they're looking into whether or not they're going to have book fair, because they can actually have a physical in-building book fair. They're going to try and work with the elementary schools to have it part of their library day, so that the kids can go down during their library class. And then they are having their annual plant sale, date to be determined. We also talked a little bit about having the community exploration kids give them a hand for some of these events, so the kids can be out in the community helping PTO, and then I suggested maybe try the senior center if they're looking for help. They're very strapped for parental help.
Yes.
So maybe now with some of the policy changes, maybe people will, want to help out a little bit more. But I mean, they barely had quorum at the last meeting, and I felt really bad for them. So they're working really hard. So
Yeah. Anything, are you done, Deb?
yes, I'm done. Sorry.
Thank you. No, it's okay. Vic, anything with the SOP?
We had an additional meeting, which was, I think, very helpful. And it was just our subgroup, and we're just trying to get most of the terminology agreed upon, because there's a lot of terminology, and then also to apply the SMART program to establish things that are achievable and things that can be monitored, but also looking at how do you do that from, from K to grade 12, because a lot of the objectives are broad brush, and they really have to be catered by the subgroups that they're in there. So it was a good, probably a 90-minute meeting that was in addition to what we're going to have this month. So putting in the extra effort.
All right.
Thank you, Vic.
Feel
We have
free.
a second meeting this month, which will be this Thursday night for the
Yep.
full committee.
Yep. Thank you, Vic. So I think that's it for our liaison reports. So at 7:16, I make a motion to adjourn this meeting.
Second,
Second.
All those in favor?
Aye.
Aye.
Oh, have it. There's no opposing or abstaining, so the motion carries. Meeting is adjourned at 7:16.